Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to round up again the key COVID-related issues for the dental sector. So the big news this week started on Sunday evening when the Prime Minister, Boris Johnson, announced the new official advice would be to work from home if you can and to go to work if you can't. And understandably, that caused a lot of queries and anxiety amongst dentists and their team over whether or not dental practices would be opening this week. So let's just clarify. First of all, the advice was for England only. Secondly, there's no indication that the frameworks for the provision of care have changed, and that point was reinforced by CDO England, Sarah Hurley, later in the week. Obviously, we are looking now at post-lockdown scenarios, and I'll update on that issue, but for now it's important to note nothing's really changed. Dentists are still to treat via advice, analgesics and antibiotics where appropriate, and we'll update you as and when this advice changes. Post-lockdown is clearly the key phrase this week, and it's going to remain so for a little while yet. A lot of preparation is underway to shape how dentistry will look when restrictions are gradually eased. And this week, NHS England and the CDO for England hosted the first of a series of meetings to outline how dental activity in England will increase in the next phase. We were well represented at that meeting, also including Department of Health, CQC, the GDC and the Faculty of General Dental Practice and many other organisations. The approach to expansion looks like to be based on opening as early as is safely possible, and having a degree of consistency as much as possible between NHS and private dentistry. We haven't been given any specifics on dates yet, but rather it looks like the pace of getting back to work is going to be based on a number of conditions rather than specific dates. For example, what the R number is and the number of virus cases in the population. We will be meeting again next week and we'll clarify further when we can. In Northern Ireland, the Acting Chief Dental Officer Michael Donaldson set up a General Dental Services Committee on the post-COVID-19 recovery period, and 4 of our representatives will be joining that committee to make sure the dental voice is heard. In Scotland, the government started the dialogue with the profession, has written to the NHS boards in Scotland asking them to develop a map for moving ahead into the next phase, or as they call it, their mobilisation plans, and more on that to follow soon. Meanwhile, BDA Wales has been in consultation over the last few weeks with the Welsh CDO, Colette Bridgman, around next steps towards a new normal, starting later this summer. There's likely to be a roadmap published by the Welsh Government in the coming weeks, and we'll share that as soon as it becomes available. It's been a positive and collaborative process in Wales to date, and we'll have more details over the coming weeks for you. We announced earlier in the week that we've instructed law firm Brown Rudnick to examine insurance policies affecting dental practices, and that's a result of insurers not paying insurance claims made by dentists in response to business interruption during the pandemic. And the legal advice that we get will be shaping our guidance to members. Dental practices have been left with a lack of effective insurance cover during a period during which routine care has of course been suspended and cash flow for many practices fallen. So we hope to be able to give members a better understanding of their legal position and allow them to consider and us to consider representations to the Financial Conduct Authority. Incidentally, please fill in our survey on your own circumstances. The link will be available beneath this video. A couple of points for associates. The Self-Employment Income Support Scheme went live earlier this week, and the launch of the scheme highlighted a particular issue for self-employed associates who are earning under £50,000. If you're in this category, then you're eligible to apply for the scheme, but also under the various NHS schemes across the UK, self-employed associates are also entitled to receive ongoing NHS income. So, if you receive NHS payments and are eligible for this scheme, then potentially you could find yourself in the position of your combined earnings exceeding your normal earnings. Unfortunately, there is not a mechanism to make a part application under the scheme, An application is based on total previous earnings with no ability to split out NHS and private income. So an associate either has to apply for the scheme or not. We've asked HMRC to see if there's a way around the difficulty. For example, if an associate making a claim under the scheme is able to subsequently pay back any excess income once it becomes clear what their earnings have been for the period. So we're waiting to hear back from HMRC, and we'll update you as soon as we can hear anything on that. Also on payments to associates, as we've updated previously, NHS England's letter of preparedness of the 25th of March indicated that contract holders would continue to receive NHS income as long as certain conditions were met. One of those conditions was that practices were required to ensure that associates, as well as other staff, continue to be paid at previous levels. There's been much discussion as to what this means. We've said an obvious starting point is an estimate of the associate's net pensionable earnings. And we know that the vast majority of contract holders have taken a responsible approach to associate payments, but our contract resolution service is still hearing that some practice owners are not being consistent with what was outlined in the letter of preparedness. We've been discussing this with NHS England, and they are considering introducing regulatory change to ensure that contract holders pass on the anticipated payments. We'll of course keep you updated on that and all other work that we're doing on your behalf. So that's all from me this week. Have a safe weekend, and I'll be back with more updates next week.